Good evening, folks, and thank you for joining me at this hour now. This evening's top story, we'll be talking about the latest updates about coronavirus outbreak. Let's start off with some news in Canada involving COVID-19.
CBTN News, with Ethan Chen.
Toronto is shutting down all of its city services on Saturday at 12:01 a.m. as the number of COVID-19 cases and deaths are continuously increasing. City Manager Chris Murray said shutting down the city is necessary to help slow down the distribution of the COVID-19 infection in Toronto and to protect people including seniors, people with compromised immune systems, and individuals experiencing homelessness. However, the TDC is not being affected as it will continue to run throughout the city. All public libraries and city-run daycare centers will be closed as on Saturday. And so we have a list of programs that are being closed. Prime Minister Justin Trudeau said that his wife was diagnosed with COVID-19. Even though she was tested positive, her symptoms are mild and she is feeling well. She has left a message to say that she'll be back to normal soon as she is in isolation for 14 days.
It's a COVID-19 bombshell. The Prime Minister and wife self-isolating. The NDP leader in self-isolation. The First Minister's meeting cancelled. The coronavirus wreaking havoc on Parliament Hill. The Prime Minister tweeting, Sophie recently returned from a speaking event in the UK, and last night she was experiencing mild flu-like symptoms. She's feeling better, but following the advice of our doctor, she's self-isolating as we wait on COVID-19 test results. Out of an abundance of caution, I too will be self-isolating and self-monitoring until we get Sophie's results back. The Prime Minister says he has not yet been tested for COVID-19. NDP leader Jagmeet Singh is self-isolating as a precautionary move after feeling unwell. Meanwhile, on Parliament Hill, concern over COVID-19 is changing routines. Provincial premiers had to pull a 180 after the First Minister's meeting was cancelled. Ironically, a meeting that would have been dominated by COVID-19 concerns. Parliamentarians now wondering whether or not to suspend Parliament.
Well, I think it may be something that has to be considered, but I'm not ready to offer my opinion on that. I think there are others who are discussing that matter.
Parliament is scheduled for business tomorrow before MPs head back to their ridings next week. In Ottawa, Nigel Newlove, City News.
In other news related to COVID-19, U.S. President Donald Trump has declared a national pandemic emergency. He said that he would reject people coming from many European countries to America for 30 days. Mr. Trump's actions is planning to put in $5 billion to help the government try to fight the spread of the virus. There are more than 30 people in America that have died after being diagnosed with COVID-19, and there are over 1,200 infections in 46 states.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and aside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients.